Many of the oral formulations are available only in the immediate release type of formulation like tablets, capsules, solutions, syrups and suspensions and many others. Some are available as sustained release or modified release. And some of the drugs are available in many type of the formulations like they are available as immediate release also. They are available in the formulations with sustained release or extended release profile also, delayed release profile also. So how the API is formulated into immediate release formulation or sustained release formulation or modified release formulations, and what are the reasons for making the immediate release and the sustained release dosage forms. Many of the times the immediate release formulations are converted to the sustained release type of formulations. So why this is done? I welcome all the viewers to this topic. It will be a very informative and interesting topic to understand the reasons for making the sustained release formulations, also for converting the immediate release formulations into sustained release. I request you to be with me till the end of this video so that you will get good information and understanding about the science and technology behind the sustained release dosage forms. Oral formulations are available in oral solid dosage forms and oral liquid formulations. The release profiles can be the immediate release or it may be the modified release. Modified release involves the techniques used to alter the release profile. It may be by prolonging the release, sustaining the release, controlling the release, or delaying the release. Based on that modified design, it may be called as sustained release, extended release, delayed release, or pulsatile release. Sustained release formulations are the modified release formulations which maintain the drug levels in the plasma for the prolonged period. And this is achieved by sustaining or slowing the release of the API from the formulation. Now consider the immediate release. By definition, the immediate release means the drug is released rapidly after administration with no special rate controlling features. The examples are immediate release tablets, immediate release capsules, sachets, granules, and some others like oral solutions, suspensions. The aim or goal or objective of the immediate release formulations is to get the quick onset of the action. Examples paracetamol, ibuprofen tablets, many formulations are there. What are the limitations of the immediate release? So it requires frequent dosing to maintain the plasma profile. Then the plasma profile, because of repeated administration of immediate release formulation, will vary or fluctuate. Plasma concentration fluctuates and it may cause the side effects due to high Cmax. Once you administer the IR tablet or capsule, the entire content or dose will be released and absorption will happen. The absorption will go on and it will reach the maximum limit, that is Cmax, and the time of Cmax, that is Tmax, will come, and after that it will decline. The same condition will happen after the second administration of the dose of IR formulation. So there may be the chances of side effects because of fluctuations, rapid increase in the API content in the plasma or drug content in the plasma, and then decline. So why the sustained release formulations are required. Always consider that the sustained release formulations will provide you some of the benefit compared to the immediate release type of formulation. And this is the logic, or you can say the science, behind converting the IR formulations into the sustained release formulations. All the IR release formulations cannot be converted to the sustained release. That is also true. And some limitations are there. Some scientific requirements are there based on the drug properties, therapeutic requirement, indications, and many more. So I will make a separate video on the criteria to convert IR formulation to the ESR formulation, and it will be a different video. For this video, consider the sustained release formulations are made to overcome the IR limitations. The problems of IR formulations or the lacunas of IR formulations can be overcome by making the sustained release type of formulation. ESR formulations provide the longer therapeutic effect from the single dose because it is sustaining the release. It may improve, it can improve the patient compliance because patient is taking fewer doses. It can reduce side effects by avoiding peak concentrations. So as it is releasing the API slowly absorption will happen and there will be lesser amount of the drug present in the plasma at one time. That means the shoot up of the plasma drug content will not be there. It will be very slow. So that's why it can reduce the side effects. It can enhance the efficacy by maintaining plasma drug levels within the therapeutic window. So if there is a specific therapeutic window that is between the minimum concentration for the effect and the maximum concentration which is related to the side effects, in that window the API in the plasma will be there. So it will enhance the efficacy. Sustained release formulations are those dosage forms that releases the drug slowly and continuously over a extended period. For example, if the IR tablet releases the entire content within 15 minutes, 30 minutes or 1 hour, sustained release profile will be up to at least 10 hours, 8 hours or 12 hours. For some of the formulations, it might be around 18 hours or 24 hours, depending on to the formulation and requirements. The aim or objective of the SR formulation is to maintain the drug concentration in therapeutic window for a longer duration. Examples of the SR formulations are there, like metformin is formulated into SR formulation used for the treatment of diabetes. Diclofenac is a painkiller. It is formulated as SR tablet. Coming to the pharmacokinetic differences, for IR formulation, the Cmax, that is peak, will be high and rapid. For sustained release, it will be lower and it will be controlled. Tmax for IR formulation will be short, let's say for around 1 to 2 hours, for example. And for sustained release, the Tmax will be delayed, let's say around 7 to 8 hours. Depending on to the formulation, I am just giving you the example for understanding. Fluctuations will be large for, or variation will be more comparing the immediate release formulation to the SR. So SR formulation, the fluctuations will be smaller and steady and less variations will be there. For immediate release type of formulations, the dosing frequency is more. Multiple times dose is required to be administered, but for the SR formulations, the frequency will be less and patient compliance will be lower for immediate release compared to the sustained release. Then advantages of the SR: better patient compliance, reduced dosing, reduced pill burden per day, reduced amount of excipient administered per day, stable plasma levels, consistent therapeutic effect may be there by the use of SR formulations, and lower side effects. Many of the formulations are converted to SR formulation from the IR type of formulations to reduce the side effects. Also, the dose reduction may be there in some of the formulations. Disadvantages of SR: there is a risk of dose dumping. Dose dumping means release of more amount of the drug in a short period than the expected. SR formulations are complex formulations considering the cost and manufacturing, and these are not suitable for the drugs which have very short half-life and the drugs which are belonging to the class of drugs that is narrow therapeutic index. The drugs which have the longest plasma half-life, they can be formulated as IR formulations, and there is no need to convert those into the SR formulations. Now, example of transition from IR to SR. When you can convert or you should convert IR to SR. Example is metformin IR versus metformin SR. Metformin sustained release tablets reduce GI irritation, and once or twice daily dosing is possible, which can improve the patient compliance. Diclofenac IR converted to SR for better pain management and less GI upsets. Theophylline IR to SR will give the better asthma control by maintaining the plasma drug levels, and fewer doses will be there. Now coming to the techniques for SR formulations, many techniques are there. You can make the matrix systems, you can use reservoir system, osmotic pumps, ion exchange resins, you can use coating with some polymers and make the sustained release type of formulations. IR formulations have the fast onset and the action will be short, so multiple dosing will be there, pill burden will be more per day for the patient, compliance will be less. SR formulations have the control release, prolonged effect will be there, and it can improve the patient compliance. Also, for SR formulations, the incidences of side effects will be less. SR formulations to be preferred and prepared for the drugs which are used in the chronic treatments like heart diseases, diabetes, and many others. So, converting IR to SR formulation is a patient-centric approach for chronic conditions, and it will have a benefit. I hope this video will give you some information and idea about IR to SR conversion and how IR and SR formulations are selected and prepared, what are the advantages, disadvantages, and also how you can move from IR to SR. Thank you for watching the video.